On the way. Again, this is good news, but we still need more. We know that a hospital...
Michigan Governor Whitmer
will go through 10,000 of these masks in a day. And so this is a helpful now in this moment, but we have a much greater need that we all need to be a part of making sure we meet. I want to acknowledge a few more businesses
Lansing,
that
Michigan.
have stepped up, and a number have, but Steelcase in particular, production of masks and face shields for our nurses and doctors. Dow and the dedicated employees that they have are manufacturing hand sanitizer. I signed a number of executive orders in the past couple of days, including orders that push all April 2020 state and city income tax filing deadlines to July of 2020. We've also expanded absentee voting in the May 5th elections. We've established a $2 million Water Restart Grant program to restore service and access to clean water for Michiganders. We are protecting vulnerable populations in Michigan's county jails and local lockups in juvenile detention centers during the ongoing COVID-19 pandemic. And we've relaxed the scope of practice laws to give hospitals and other healthcare facilities the flexibility that they need to successfully deploy qualified physician assistants, nurses, and other healthcare providers to combat COVID-19. I signed 2 executive directives temporarily restricting discretionary spending by our state departments and agencies and temporarily suspending hiring, the creating of new positions, filling vacant positions, transfers, and promotions within the executive branch of state government. We are doing our part. I signed an agreement between Michigan and the U.S. Department of Labor to implement pandemic unemployment assistance and compensation programs to grant benefits to workers who do not already qualify for unemployment benefits. These workers include the self-employed, 1099 independent contractors, and low-wage workers who can no longer work because of this pandemic. The agreement also includes weekly benefits for all unemployed workers by $600 and extends benefit payments from 26 to 39 weeks. And I accepted the recommendation of the U.S. Army Corps of Engineers, the Detroit District, for an alternative care facility conversion at the TCF Center in the city of Detroit. FEMA will fund the construction and supply the state, which will have, and this space will have 900 bed spaces approximately. So we have a few more updated numbers. As of 3 o'clock yesterday, we had 5,486 confirmed cases of COVID-19, 132 deaths. We know that this number is going to continue to go up. Despite our aggressive efforts, this is to be expected. We will not see the benefit of these aggressive efforts for a little while. And that's why it's so important everyone continues to do your part. But I think it's important to pause for a minute and remember that each of these 132 Michiganders who've lost their lives had stories and families and friends and loved ones. People that we need to think about the real loss as we are combating a pandemic that is hurting our state and our people. Can't lose sight of that. Over the weekend, MDHHS launched a new volunteer website, www.michigan.gov/fightcovid19, where trained medical professionals can register to serve their fellow Michiganders by assisting hospitals in fighting COVID-19. We expect a great need for additional medical support in the coming days, and so we ask, please sign up now. State residents can also use the site to find out how they can help in their local communities, how they can connect to give blood or donate money or needed medical supplies. We've seen an incredible amount of strength and courage of Michiganders during this hard time of uncertainty, whether it's from communities donating food, money, and resources to those that need it, or from businesses using their technology to manufacture personal protective equipment. To bend the curve and slow the spread of COVID-19 in our state, we must all work together as Michiganders. Whether you're a medical professional looking to volunteer or someone who can give blood or donate to your local food bank, everyone can help out. We will get through this together. And when you see those numbers rise, don't think that it doesn't mean your participation, your staying at home isn't having an impact, because it is and it will. Today, I also signed 2 supplemental budgets that reprioritized funding to slow the spread of COVID-19. The supplemental was negotiated in good faith with my administration and the legislative leaders. Key priorities from both sides were included in the bill. But the world has changed since those negotiations, and we must react and change along with it.
Ew.
I'll commend our state budget director, Chris
Fly.
Gold, and the legislative leaders who engaged and agreed that due to the incredible toll that COVID-19 has taken on our health and our families and our economies, that it was important that I veto a number of line items to save tax dollars. It's too early to determine the exact impact on state revenues, and knowing there is the potential for a significant loss in revenue, now is not the time to sign a bill for supplemental funding for anything other than dollars that can be utilized to help our COVID-19 response. I want to thank the legislative leaders, the Senate Majority Leader, Mike Shirkey, the Senate Democratic Leader, Jim Ananek, the House Speaker, Lee Chatfield, and the House Democratic Leader, Chris Gregg. I'm grateful for their partnership during this tough time. With this action, today, we will be committing $150 million to combat COVID-19. To date, the state has already expended more than $80 million to begin securing the more than 20 million masks, 2,000 ventilators, nearly 9 million ounces of hand sanitizer, more than 255,000 boxes of gloves, 2.4 million gowns, more than 2,000 beds, 210,000 testing kits, 3,000 thermometers, 185,000 face shields, 22,000 cartons of disinfecting wipes, as well as other needed supplies. We have contracted for these things, and it is our hope that they all will get to Michigan as our contracts reflect and require. Getting through this crisis requires all hands on deck. We're working together in an unprecedented way to fight this unprecedented enemy, COVID-19. I'm proud of the leadership of our team, and that is inclusive of everyone here at the Capitol. People across our state are stepping up and doing their part during this time of crisis. Amy, who is using her time to clean up local rivers and waterways, all while social distancing. Lisa, who is taking care of her 90-year-old mother and sewing masks for her neighbors who are healthcare workers. Paul, who is working from home wherever possible and maintaining our phone and internet services. Marie, who is working with our church to deliver food to families in need. Courtney, who's a teacher who's using Zoom to stay connected to our students. The coming days will be unlike any challenge we've ever had before. It will require fortitude, strength, and grace. Our frontline care workers, they need more support. Our sick will need more beds and care. Our unemployed will need help. Our businesses will need information. But Michiganders are strong, smart, and determined people. We've always looked to one another. No matter who you are, where you come from, how you identify, no matter your age, your risk factors, your race or socioeconomic status, your health and safety matters. And I will keep fighting for you. We will get through this together, so long as everyone does their part. And with that, I'm going to turn it over to our Chief Medical Executive, Dr. Janae